My name is Mateusz Pucek. I'm a GP and I'm a founder and clinical director of 360 Health Clinic, and we are a private GP clinic specializing in prevention and treatment of chronic medical conditions using 360 health approach. What I saw in medicine beyond traditional medicine medical approach is that healing and medicine and healing does not necessarily mean the absence of disease. That healing can occur on a, let's call it, spiritual level with a smaller s, and perhaps this healing is more important than the physical one. What prompted me to form 360 Degrees Health is my realization that there's plenty of chronic medical conditions that can be either prevented or treated by addressing so-called modifiable lifestyle factor. But the difference in our clinic is that we do that, but we also address the mind, body, and spirit entity. So the 360 Degrees Health approach is our attempt to provide a comprehensive treatment solutions to patients who either want to prevent or augment the treatment that they're already on for chronic medical conditions. And the way we do it is we address all the lifestyle factors that contribute to development of medical conditions, and we work on the mind and the spirit side of things as well. The lifestyle factors that matter in health and disease and that we address through 360 approach are things like nutrition, are things like movement or lack of movement, things like stress and resilience to stress, things like sleep, and also relationships. But by relationships, I mean relationships between your mind and the body, but also relationships between you and people around you, and you and the greater world that there is. Genetics do matter in health and disease, and we now learn, as we learn more about genetics, we learn that there are certain genetic traits that predispose us to development of certain medical conditions. But the most important message that I would like to convey is that even though you may discover that you have a predisposition or specific gene for a medical condition, that does not mean that you will develop this particular condition. So if you address lifestyle factors well, you reduce your chances of developing a disease. In 360 Health approach, we occasionally offer our patients supplements, but we only do it in very specific conditions where there is justification for their use, and we know that there is good evidence that patients might benefit from them. When I think about medical conditions that we can treat using our approach, I struggle to think about any chronic medical conditions that wouldn't benefit from the modalities that we offer. So we can help with things varying from anxiety and depression, where we know that lifestyle factors matter. We can look then at neurological conditions like MS, dementia, and so on, gastrointestinal issues, chronic pain, you name it. I think that if anybody suffers with a chronic medical conditions, we may be able to help. 360 Health Clinic is not an alternative to traditional medicine. We are regulated medics. I am a member of the GMC. I am a doctor. I am a GP, and what I do is what I think a good medicine should be. And we work in collaboration with traditional medical consultants because we believe that the modalities that we offer, the treatments that we offer, supplement or augment the approach that or the treatments that they deploy. A patient should consider working with 360 Degrees Health Clinic because we can help with variety of chronic medical conditions. That's first of all. Then second of all, we can augment the traditional medical treatments that patients are already under. And third of all, we eliminate confusion. So there's plenty of information out there on the internet. The well-being business is full of conflicting information. For example, which diet is the best, what type of movement I should use, and so on and so forth. So we look at whatever evidence there is, and we try to select the best options for a particular patient, and we take that patient into account as an individual, so our treatment are individualized. A typical patient's journey in our clinic begins from our thorough assessment of medical background and past medical history. That starts with us gathering information using internet-based questionnaires. Then this is then followed up by an initial medical assessment that can last up to 1.5 hours on some occasions. And then we would formulate a plan, and then we would discuss this plan in a follow-up appointment of 30 minutes. This plan may be as simple as us recommending certain interventions that patients deploy themselves, or we may refer patients to other professionals that we collaborate with, such as movement coaches, nutritionists, psychologists, mindfulness coaches, and so on.